Self-breast examination generally does pick up. See, it depends on the breast size as well. If it's a very small size, like, if it's an A cup or a B cup breast, the woman is generally very thin, then even a smaller lump can be detected. But if it's a larger breast, then possibly not. And Indian women, as such, are large breasted. So sometimes small lumps can get missed, but it can, as and when it's growing, you can feel it to be an abnormality. So, unfortunately, cell breast examination, like I said, true negative. It's not 100% true negative. It's something that is a bridge between getting a mammogram and an ultrasound and finding the cancer. It's basically a lifestyle that matters, and you will be very surprised to see how everything reduces when you have a healthier lifestyle in terms of exercising regularly, cut down caffeine. Cutting down caffeine is the biggest thing, and eating a lot of fruit and vegetable compared to our general food, getting good amount of sleep. All these are actually underestimated even in terms of breast health. You'll be very surprised to see how all of them help you. So try to modify your lifestyle first, wearing supportive bra, exercising regularly, getting a good amount of sleep, eating well. These are the ones that will actually help you a lot.
So we have Dr. Kalla.
Good morning, ma'am.
Yes, good morning.
I'm a consultant gynecologist at the semi-urban area. I want to ask you, ma'am, whether from 40 to age of the 40 to 50, we should undergo the mammogram.
Yes.
Whether it is mammosonogram or mammogram only.
Mammogram. And
Mammogram.
generally,
But in such area, in our area, it's not available for all patients. We have to go for district places.
yeah, see, that's the issue, unfortunately, that resources are constrained and infrastructure is not available everywhere.
Yes.
So, I guess if they can actually go to a district and get a mammogram, that's the best thing
Yes.
they can do. If not, then I guess an ultrasound. But remember that even ultrasounds have to be done by extremely trained breast radiologists, because that's where her
Yes.
mistakes are.
Yes. So and after menopause, after menopause also you have to go for this thing only, na? Mammogram only.
From the age of 40, everyone should have mammogram.
And then how often it is? Once a year or?
Once a year.
Okay. Thank you, ma'am. Thank you.
So we have Shmuel. So he is asking, what is the role of authorities in protecting breasts?
Oh, authorities. Okay. Well, it depends on what level of authorities these are, but it is in the hands of the government to establish multiple mammogram centers throughout the country in smaller areas as well, because Dr. Shashikala just asked a very good question with regards to getting a mammogram or an ultrasound. First things first, getting mammograms done everywhere, getting access to them, giving them access, and secondly, also bringing about a lot of awareness amongst all these women, saying that there is something called breast cancer. There is, because I'll tell you why I'm saying this, because and then letting them know that there is something called breast cancer, what exactly you should understand about it, what is a mammogram, when you should get it done. And this is the basic awareness that these women should be aware of, because we are running a mammogram bus that goes to rural India and screens all the women for absolutely free. But women still don't come to us because they don't understand what a mammogram is. They don't understand the importance of it. So first of all, awareness, and second, they'll have to bring about, they should bring about talks, or people making sure that they instill it in their mind that talking about breast is not a taboo. It's a disease that's killing a lot of people. So it's something that they absolutely should know about. And then getting mammograms, sort of rampantly present everywhere, and good breast radiologists. And alongside that, also treatment wise, they should be given subsidies or given better insurances, etc. So I think it's a milieu of things rather than a single thing that the authorities can do.
What are Indian authorities doing about breast cancer in India? Indian authorities.
Well, they are doing quite a bit. At least the Telangana government does have a few plans in mind, but until they're actually implemented, we never know how plans change. But they are planning on rolling out multiple mammogram buses that go to different parts of the state and screen women. And we also have a few studies going on in terms of easier ways of diagnosis. So there are things that are going on. But until we actually get results, there's nothing that we can talk about.
So we have Sahiti ask you a question.
I'm at 30 years old. I think from last 2 to 3 years, like I have been getting like post ovulation, my breast, I have heavy breast as well. So I do getting breast pain. So I've been to like few doctors and also to an oncologist. They diagnosed me with fibroadenoma, but the pain still keeps coming. And sometimes the nipple part of my breast hurts. I feel like I have been to multiple ultrasounds as well. The reports were quite normal, but whenever it pains, I feel like there might be a discharge or something might be happening. So what can be the cause of it? And also like when I take some foods like more caffeine or some kind of junk, I feel this more often. Like, is there something to worry about?
Sahiti, you're giving your answer yourself, Sahiti. Honestly, you've given the answer yourself. It's basically a lifestyle that matters, and you will be very surprised to see how everything reduces when you have a healthier lifestyle in terms of exercising regularly, cut down caffeine. I'm guilty. I'm here drinking my coffee as well. So, cutting down caffeine is the biggest thing. And eating a lot of fruit and vegetable compared to our general food, getting good amount of sleep. All these are actually underestimated even in terms of breast health. You'll be very surprised to see how all of them help you. So try to modify your lifestyle first, wearing supportive bra, exercising regularly, getting a good amount of sleep, eating well. These are the ones that will actually help you a lot. Having said that, if this is only after your ovulation, before your cycles, this pain, etc., then it's called premenstrual syndrome, which is unfortunately very normal, but it's very normal, especially that it reduces after that. There's nothing much that we generally do for this except just symptomatic care by giving hot fomentation or any pain medication and things like that. But otherwise it's absolutely normal. Fibroadenomas, just make sure that you keep a track of the size, and if it's about 3 centimeters or if it's growing, then that's something that you need to get sorted out.
Oh, ma'am, just one more thing, like will this be turned to any kind of cancerous symptoms? Or...
Fibroadenomas as such don't generally turn into cancer, but having said that, there was one case of mine who was around 32 years old or 29, I'm not quite sure. 10 years of having a fibroadenoma lump, it turned into a cancer. Generally, it does not, right? But in this particular patient, unfortunately, it did.
Okay, but when I get changed to healthy lifestyle, so does this go fibroadenoma?
We can have it. No. So once it's beyond a certain size, they generally do not disappear until you reach menopause because it's all hormonal imbalances.
Yeah, I do have some kind of rubbery lumps. Like I can feel them, but because I got tested, I feel that it is kind of safe. But I also think, is there something that is not getting detected on ultrasound? Do I need a mammo at 30 years?
No. Don't get mammograms at 30. See, that's where, you need to trust your doctor and see if, she's experienced enough to tell you the right thing to do.
Okay.
Yeah.
Thank you, ma'am.
Good luck.
Thank you, Sai. We have the Varsha Deshpande. Ma'am, you can unmute yourself and ask your question.
I wanted to know, in your experience, self-breast examination can the woman pick up small lumps, and do we train them for it? Because just mammogram and ultrasound both seem to be costly in our rural part of India. What is your experience, madam?
Thank you for the question. Self-breast examination generally does pick up. See, it depends on the breast size as well. If it's a very small size, like, if it's an A cup or a B cup breast, the woman is generally very thin, then even a smaller lump can be detected. But if it's a larger breast, then possibly not. And Indian women as such are large breasted. So sometimes small lumps can get missed, but it can, as and when it's growing, you can feel it to be an abnormality. So unfortunately, self-breast examination, like I said, is not 100% false negative, right? I mean, true negative. It's not 100% true negative. It's something that is a bridge between getting a mammogram and an ultrasound and finding the cancer.
Okay. Yes, at least somebody will come to the doctor and take her opinions. Yes.
Yeah.
Thank you. It was a very informative lecture.
Thank you.
Very inspiring too. Thank you, madam.
Thank you. So we have Nadia who has raised her hand. Please unmute yourself and ask your question.
Actually, it's a little difficult for me to say, but I have been diagnosed with breast cancer, and my hormonal therapy shows ER positive when even PR is positive, and I am not sure what is going to be my treatment. Can you give me any, because it was a malignant mass, And so I would like to know what kind of treatment is the best treatment for this breast cancer.
First of all, I'm really sorry for your diagnosis. So to answer your questions, ERPR positive, HER2 negative, right? Is that what you said?
Yeah.
Yeah. So
Two, you say. That is what I have still not done my PET scan, which I'll be doing very shortly in a day or two. So
and HER2 is negative, is that what you said?
HER2 unresolved it is.
So you need to get a FISH test for that.
Oh.
Okay. So there are a few things. Am I speaking to Miss Nadia?
Yes.
Okay, so there are few things right there. We can never say that this one particular modality of treatment works for one patient, right? So you said rightfully so that your hormone therapy, ERPR is positive and HER2 is well unresolved, which means that you need to get a FISH test to understand if you're actually positive there or negative, right?
Okay.
And because HER2 being positive or negative will matter in treatment completely. It'll guide your treatment completely. Okay. And secondly, the PET scan. PET scan will accurately stage your disease. And that's what a PET scan is done for. Now, if you say, and I don't know the clinical stage of your disease right now, the size of the lump, if there are any nodes that are, positive or not, all these factors also matter when I, guide a person to go ahead and get treatment. So if it's very early stage and if it's
There have been nodes which have been affected and some 3.6 or something centimeters. Tumor size is 3.6 or something centimeters. And also they are not sure about the lymph nodes. That's what.
well, the PET scan should give you better idea. Where are you based out of?
Chennai.
Okay. If you're going to take a treatment in Chennai, you can always reach out to me offline. I'll suggest good places to you where you know what they're talking about.
Oh,
Right?
thank you very much.
Sure. And so basically, see, if your nodes are positive or negative, it completely matters on what kind of treatment you're taking. And the stage of your disease also matters. Stage 1, 2, 3 can be treated with something. Stage 4, you don't need surgery. Honestly, there are a lot of things that go into this, and getting the accurate information is important before I suggest any kind of treatment for you.
Okay. Thank you very much. Thank you.
Sure.
I'm relieved somewhat to talk to someone. Thank you very much.
Good luck.
We have MP who has raised their hand.
Ma'am, I have a question. I have heard about something on the lines of thermal mammography, which uses heat to detect breast cancer. And I have also heard that it is less painful than the traditional mammography. Is it true? And if it is true, how effective is it?
It's less painful because there's nothing that they actually do in that except just point something at the breast. I would never get that done because it gives you a lot of false positives, increases the anxiety in the patient, and also does not give you the answers that we require for treatment.
So basically, it is ineffective. There is no point in getting it. Oh, okay. Thank you, ma'am. Thank you so much.
Ma'am, can you unmute yourself and ask your question?
Savita here. What are the blood tests that tell us about the risk factors that there is an inclination towards getting the
Unless you have a strong family history and any of those patients who are affected with cancers are positive for any genes, right? You don't need to necessarily get any other test because there are no blood tests that will lead you towards a diagnosis of breast cancer. There are certain studies that are trying to come up with something called ctDNA, that's circulating tumor DNA with liquid biopsies, but nothing is conclusive right now.
What about the CA-125 and other multiple things they tell them?
CA-125 is for ovarian cancers and not for breast cancers. So ovarian cancers, it sort of gives ovaries, unfortunately, are not something that can be screened very easily, which is why lots of them are incidental findings on surgeries or they come to us in stage 3 or 4 because it's not easy to screen. Ovarian cancers, you use CA-125, but not for breast.
Okay, any diet factors, ma'am, that help us even it is general for general population?
Unfortunately, most of our food is adulterated. Unless you can have your own organic, farm and getting your milk, eggs, vegetables, fruit, etc. from there. I don't know what is adulterated, what is not, and everyone is at a risk. All of us are at a risk, honestly, and that really scares me half the times, but there's nothing else that we can do.
Okay, thank you.
So there's a question from Miss Sahiti. Is the nipple pain at some days something to worry about? Also, can the breast size increase with age post 25?
Yeah, if you generally gain weight, it can increase in size. Or when you get pregnant, or when a person becomes sexually active, or when you start breastfeeding or things like that, yes, it can increase in size. Nipple pain is normal sometimes. It's also a part of this premenstrual syndrome. So you just have to understand how this is happening and understand the flow of events.
So there's a question from Surya Prabha. I have some query while pressing tits, getting oily substance, like someone or two drops, not daily, rare, very rare. That too only pressing. What's the reason? Maybe menstrual times or hormonal change?
Yes, that's your answer. Sometimes just physiological. And when you when you examine yourself and you squeeze the nipple area on your breasts, yes, that can happen sometimes. And that's normal and physiological.
So this is a question. Are fibrocytic lesions in breast a normal?
Yes, they are. Yes, hormone replacement therapy leads to breast cancer. I mean, there is a continued, consumption of estrogen does cause breast cancer.
This is a question from Sahiti. I have been to OITI medications for fertility and they suggested estrogen medication for 5 days. Are they safe? How long can we use them? I have used them for 1 month and haven't experienced any breast tenderness, which I usually get every month. Any side effects? Please answer.
If it's fertility, if it's just a fertility, IVF, etc., generally these short courses, we don't have evidence saying that they cause breast cancer. But prolonged usage of it, yes, around 1 year, more than that, yes, you can get affected with it.
Thank you for your time. You have taken your time from your busy schedule for our audience. It was lovely talking to you and our audience.
Thank you. Thank you so much.